Hi, my name is Dr. Katie Fraley. I'm a physical therapist at Balance Physical Therapy here in Monterey, and today I'm going to talk to you a little bit about movement analysis. So let's say that you've shown up for your evaluation here at physical therapy. The first thing that we're going to do is sit down, talk about your condition and what's been going on with you, and usually by the end of that, your therapist has a pretty good idea of what might be going on with you. So one important thing that we like to look at is how you move. The way that you move can tell us a lot about your condition, your impairments, and why you might be having pain. So one of the common movement analysis that we like to do for an individual who has lower extremity pain, whether it be pain in your hip, your knee, your ankle, is going to be a single leg step down. And this is especially common if you're an individual that might have knee osteoarthritis. This is something we'll definitely look at for you since a lot of you guys complain about pain with going downstairs. So this is going to similarly replicate that movement. So this is what that single leg step down looks like. So we might ask you to do this a couple of times. We'll watch the way you move. And then we're going to be looking at all the different joints in your leg. So we're going to be looking at your ankle, your knee, your hip, and seeing how all those move in conjunction to one another. So let's say I'm looking at your pelvis, and as you step down, we start to get a little dip. For example, that dip might indicate that you might have some gluteal weakness or weakness on the side of your hips that might be contributing to a lack of stability when you're stepping down. We also might look down at your knee. Maybe your knee caves inward as you come down. That could indicate something going on local at the knee, but could also be due to impairments up or down the chain. So what's going on at your hip can affect your knee, and what's going on at your ankle can also affect your knee. So that's why it's important to look at the whole leg as a whole, rather than just isolating or fixing on one portion of the leg. So same thing if you have overpronation in your ankle, that can also contribute to that caving in or that valgus of the knee, which might cue you into maybe there's a local ankle pathology that's going on that could contribute to why you're having some discomfort at the knee. And then lastly, let's say you're going down and you feel unstable, you need something to hold on to, maybe you need a rail, maybe you need a stick, something stable to hold on to. That just might indicate that maybe there's a balance impairment, and maybe adding some balance and stability might be something that you need in your treatment to help you with some of those daily activities. So let's say you want to come to Balance Physical Therapy to address the pain that you might be having in your knee, in your hip, and your ankle. It's important that we take a look at some of these movements for you so we can see what's going on and help develop an individualized plan of care to help meet your own needs.